I had a MMA fighter. He owns an MMA gym. His knees were really bad. We did a second round of stem cells, and then I initiated the red light. And within 3 weeks, he was 80% better.
Hey everybody, Dr. Rothschild here. I have Dr. Chiriano online with us, and he's going to be talking to you about red light therapy and incorporating that with stem cell therapy. But first, Doc, I'd really like you to tell us a little bit about yourself, and then you can go into more detail about how these two type of therapies work hand in hand.
Okay, thank you. Yeah, I'm Dr. Chiriano. I'm a double board certified in general surgery and vascular surgery. I've been practicing for over 15 years, and I made the transition into integrative medicine and stem cell therapy about 3 years ago. And I've just been seeing miracles happen all the time. So we're helping people in a way that what I was doing before we couldn't do.
I was just talking to you about how stem cell therapy in conjunction with the red light seems to work really well. I just wanted to get your take on that. So how's it going for you?
So it's going really well. You know, we've had some experience now with both ways of doing stem cells. The first way, when I first started, we were just doing stem cell therapy and kind of sending people on their way. What we've found is some of those patients didn't get better. And then what we've done is a second round of stem cells and then incorporated in red light therapy. We've had a much better response. For instance, I had a MMA fighter. He owns an MMA gym. His knees were really bad, and we had done stem cells on both of his knees. He had essentially no improvement from the stem cell therapy over about 2 months. We did a second round of stem cells, and then I initiated the red light, and within 3 weeks, he was 80% better. And this has just been, I think, the way to go. I think, you know, stem cells need to be activated once they're in the body. They do activate a little bit on their own, but modalities like red light therapy that activate mitochondria, that work on cellular respiration, that bring in the building blocks and help mitochondria of the native cells work better to regenerate. I think it makes scientific sense that adding something like red light therapy that works at mitochondrial health and cytochrome C oxidase will help those cells be able to regenerate much quicker. So I've been really impressed by it.
How many treatments do you think it would require with the red light and the stem cell, but with the red light in particular, before the provider or practitioner would actually see a change?
Yeah, so our current understanding of stem cells, we quote them about a 10% improvement per month just with stem cells. So if that means without anything else involved. I always put patients on a 6-week protocol. So they're doing red light bed. Every patient gets a home red light source, but I also recommend that they come in twice a week for the red light bed therapy. Some of them only come in once a week. I'd say over 90% of them are coming in at least once a week for the red light bed and then also using red light at home. But within 6 weeks, what I'm seeing is way more than 10% to 15% improvement over that 6-week period. The other thing that I think the red light helps with, sometimes when you inject the stem cells, you get a pretty intense inflammatory reaction from the stem cells, and people's knees get really swollen or whatever joint you're putting them into. And I think something like the red light helps diminish that inflammatory reaction much quicker. And so they start feeling better quicker. So usually about 6 to 8 weeks. And it's interesting because, you know, when I did this, at least even 3 years ago, it wasn't even as adopted as it is now. I was just listening to a YouTube video today that was a vascular surgery fellowship boot camp video, and one of the speakers was a vascular surgeon. And the topic of the discussion was microcirculation and lymphatic physiology. And the basis of the talk was that, you know, unless we address microcirculation and lymphatic physiology, that whatever we do as surgeons, whatever we do in traditional medicine isn't going to work as well because the end organ isn't getting supplied the way that it needs to be. So a lot of these modalities, including red light, you know, focus on cellular health and microcirculation, which is why I think we're seeing such good results. And it's interesting to me that the traditional medical community is just now starting to realize this. So the speaker was saying that, now as physicians, we need to be much more open-minded to the microcirculation aspect of everything.
Yeah, so that, I agree so much about this microcirculation because doing the red light trifecta bed, the vibrogenics, it's just amazing the circulation my body has, even about the fascia. The fascia, if it's frozen, it's not working, it's not moving. I've done stem cells, but now the power of this trifecta bed with the stem cells, I think every doctor should be using some kind of red light therapy, and especially the trifecta red light, just because it is so powerful. I've tried so many different red light beds. Trifecta is by far the best on the market. With the stem cells, the inflammation of both of them, it's the only way to go. So I think all these doctors, all these falls doing stem cells, you're going to get much better results with the trifecta red beds. That's kind of my input, and I'm advocating this whole concept of having the best body ever and feeling the best at any age. So that's what I like to say.
Yeah, I think the trifecta bed, I agree, is probably the most powerful, best bed on the market right now. And I think, it gives you a lot of variability in what you can do with it, especially setting the different frequencies of the lights, which I also think is really important when it comes to red light. So adding that aspect to it, I think has been really important.